So now we will take up the other part of GIT drugs which act on the gastrointestinal tract. In the class, we have already discussed the first set of drugs, that is antacids, carminatives, peptic ulcer drugs, and so on. So now we will take up the new set of drugs. The first category are the emetics. So an emetic is defined as any drug which produces vomiting. So we are very familiar with the process of vomiting. Many times when we have a stomach upset, we have this vomiting sensation or we have nausea. So what exactly happens during the process of vomiting? Although it seems like a very simple thing, it is a complex action and it is controlled mainly by a center in the medulla, which is called as the vomiting center. Now, this vomiting center is also under the control of another center in the medulla, which is called as CTZ, that is chemoreceptor trigger zone. So, whenever there is any kind of irritation of the CTZ or irritation of the vomiting center directly, then that results in the process of vomiting. So, any drug which is able to produce vomiting is called as an emetic. Now, normally we think that vomiting is an undesirable process. We don't want vomiting to happen, correct? But there can be certain situations where you need something which has entered into the esophagus or stomach to be expelled out of the body. Like suppose somebody has ingested a poison. It may be that intentionally, purposely they took the poison, or it may be that without their knowledge, somebody else has given them the poison. So in such cases, if the poison has entered the GIT, then you want that poison to be thrown out of the body. So for that reason, we may require to use emetics. So these emetics that we use are classified into mainly three categories. So you have the first category of drugs, which are the chemoreceptor trigger zone stimulants. That includes compounds like morphine, apomorphine, and hydergine. Hydergine, you remember we talked about in the previous class. It is one of the derivatives of ergot. Then we have the second category of compounds, which are the gastrointestinal irritants. So compounds like mustard, copper sulfate, and hypertonic sodium chloride. They will irritate the GIT, and because of that, they will cause vomiting. And then there are a third category of drugs which have a combination of both these two categories action. So they will stimulate the chemoreceptor trigger zone and they will also irritate the GIT, because of which there will be vomiting induced. So that examples for those drugs are digitalis and emetin. So in this table, I have explained the properties of each of these drugs. Apomorphine has to be administered by subcutaneous injection, and within 15 minutes of injecting the drug, it will stimulate the CTZ and produce emesis. Then mustard is just what we use at home, no? Sasve, that mustard, it will release a volatile oil, and that volatile oil is going to be irritating to the gastrointestinal tract, and because of that, it will produce the emetic action. Copper sulfate also irritates the GIT and it can be used in treatment of poisoning. Similarly, hypertonic sodium chloride, when you give a very highly concentrated solution of sodium chloride, then it will cause dehydration of the stomach wall. And because of that, there is reflex action of emesis. Now, digitalis and emetin have very strong emetic action, but that action is very toxic. So it is too strong an action. So that is why it is not preferred to be used. Digitalis, as you know, it's the plant Digitalis purpurea, and emetin is obtained from the natural source, which is Ipecacuanha. So, however, these substances are highly irritating and very toxic, so they are not used as emetics. Now, this was all about emetics. There is the opposite category of drugs. So if somebody is having a lot of vomiting, then it can lead to severe problems like dehydration, because when we vomit, then we are losing a lot of fluid from the body. Also, if you vomit and the acid regurgitates back into the esophagus, it will cause heartburn and irritation of the esophagus, burning sensation will be there. So it is quite unpleasant. And in such cases, we want to prevent the vomiting. So we use drugs which have the opposite action to emetics. These drugs are called as anti-emetics. They are defined as drugs which prevent or control vomiting. So there are again many categories of drugs. We have 5 categories of drugs which act as antiemetics. The first class are the anticholinergics. Examples are hyoscine and dicyclomine. Then we have antihistamines, compounds like cyclizine and meclizine. Then we have neuroleptic drugs, chlorpromazine, prochlorperazine. Then we have prokinetic drugs, metoclopramide, domperidone, cisapride. And we have antagonists of 5-hydroxytryptamine 3 receptors, ondansetron and granisetron. So what are the properties of each of these categories of drugs? Let us see little in brief. So anticholinergics, as we know, they will oppose the actions of acetylcholine on the receptors. Because of that, they will block the impulses being transmitted to the vomiting center. Also, they have some mildly sedative action, because of which the vomiting will be blocked. So out of these 2 drugs that we said, hyoscine and dicyclomine, hyoscine is used in treatment of motion sickness. Dicyclomine is used whenever somebody has spasmodic pain in the stomach, which is going to trigger that vomiting sensation. So we can use it like that as a preventive or for treating the vomiting. Antihistamines, these drugs act on the vomiting center and they also have sedative action. And as compared to anticholinergics, their action is milder. So they are more safe to use as compared to the anticholinergic drugs. So antihistamines are used in motion sickness. They can also be used to treat vomiting which arises from labyrinthine disorders. Labyrinthine disorders are disorders related to the distribution of the fluid in the ear. So you know that that movement of that fluid or the position of that fluid inside the ear also plays a role in balance and in that coordination of the body when it moves. So whenever somebody has some disturbance of that fluid levels in the labyrinth, then at that point of time they can have some kind of a disturbance in their balance, and that is similar to that feeling of giddiness or motion sickness kind of feeling. So to treat that also we can make use of antihistamines. They will overcome the emetic effect which is produced during those disorders. Then we have neuroleptic drugs, phenothiazine category of compounds. These will depress the chemoreceptor trigger zone and they have anti-emetic action. But the thing is that their duration of action is very short and they are not very effective in motion sickness. So they are not used for this purpose very largely. Then we have compounds called prokinetics. Now these are the drugs that will promote movement, peristaltic movement, because of which gastrointestinal motility will increase. And as a result of that, the gastric emptying will become faster. So whatever is there in the stomach, if that is what is irritating and causing emesis, then moving it out of the stomach further to the intestine to be expelled out of the body, then that will help to overcome the emetic effect. So that is how these prokinetics act as antiemetics. Now the most common drug which is used is metoclopramide. This is used generally in treatment of post-operative vomiting. You know that when somebody has undergone a major surgery and if they have been administered general anesthetic, then they will have that sense of nausea and vomiting. So that is following the completion of the surgery. And also whenever somebody has undergone surgery, if that vomiting is going to be there, you know that vomiting puts a huge amount of pressure on the GIT, on the chest, and overall on the thoracic cavity. So you don't want that person who has just undergone surgery to be straining like that. So you want to avoid vomiting in such patients. So to treat post-operative vomiting, we can give metoclopramide. And also person who has hiccups. I think you know what is hiccups, that kind of sound which comes where the respiratory and GI tract both go into a kind of spasm. So during that hiccups also, if somebody has Hiccups, normally we resort to some remedy, like we will drink little water, or some people say you should eat some sugar or something like that. And if it doesn't stop with all that, then there are some people who have, like, chronically they will have hiccups. So to treat that also we can give metoclopramide. Then domperidone is very common molecule. It is used either alone or in combination with some antacids. The main purpose is to treat indigestion, nausea, and vomiting. Cisapride is another molecule which belongs to prokinetic category. It does not have actual antiemetic action, but what it will do is, if somebody is suffering from GERD, which is gastroesophageal reflux disease. So in GERD, that sphincter which controls the movement of the content from the esophagus to the stomach, that sphincter will not be performing properly. Sphincter means it's like a valve, isn't it? So that valve has to close so that only whatever is in esophagus comes into stomach. We can't have the contents of the stomach going back into the esophagus. But in some people that happens. So because that valve is not strong enough or it is not functioning properly, that whatever is there in the stomach will reflux back into the esophagus, and they will have heartburn and vomiting sensation and all those symptoms. So in that gastroesophageal reflux disease, to prevent this kind of a movement of the GIT, we make use of cisapride. So it is not directly acting on CTCs or anything else, but it will prevent this reflux of the acid content from the stomach into the esophagus. Then the newer molecules, ondansetron is a selective 5-HT3 antagonist, and it is mainly used. It has very strong antiemetic action. So we know that cancer patients who are on chemotherapy or cancer patients who undergo radiotherapy, as a side effect of that form of therapy, they will have severe nausea and vomiting. So to control the vomiting which is induced in these patients because of chemotherapy or radiotherapy, we make use of ondansetron. Then the other drug in that category is granisetron. It is far more potent, about 10 to 15 times stronger in action as compared to ondansetron. And this is also used to treat vomiting in patients who are on repeat cycle cancer therapy. So those who have repeatedly, you must be aware that when cancer is being treated, then chemotherapy and radiotherapy, they are given in particular cycles. You can't just give it once and the disease will go away. It will not work like that. So you have to repeat after certain number of weeks or after certain months. Like that, there will be a pattern. So whenever there is like this repeat cycle cancer chemotherapy, then we give the drug called as granisetron. So this is all about antiemetics. So far we have discussed emetics and antiemetics. Then we will go to the next category of drugs, which are the antidiarrheals. So whenever somebody is suffering from diarrhea, which is loose motion, then we give antidiarrheals. So there are three categories of drugs under antidiarrheals, protectives and adsorbents. So these are compounds which will have adsorbent property. So we know that whenever diarrhea is caused, it is because of some toxin which has entered the body, or it is because of bacterial infection which is producing the toxins. So what these compounds will do is they will absorb those toxic substances. And second thing is, whenever somebody has diarrhea, the gastric mucosa has been severely irritated. So these drugs have protective action. They will form a coat on the gastric mucosa so that it does not get further irritated. So compounds like light kaolin, pectin, preta preparata, and activated charcoal are having this protective and adsorbent property. They were widely used in the past, but now because we have better molecules which are available, these compounds are not used so often. The second category of drugs are astringents. So we know that astringents are protein precipitants. So when you administer an astringent to a person who's having diarrhea, it will cause precipitation of the proteins in the gastric mucosal layer. So that precipitated protein will form a protective layer on the GI mucosa so that it does not get further irritated. So compounds like and tannic acid and bismuth salts, they have this astringent action. The third category of drugs are miscellaneous drugs. All drugs which we can't fit into the other two categories have been put here. So opium alkaloids can be used, belladonna alkaloids can be used, Loperamide is a very common drug. It is used nowadays. It's a synthetic compound. So this loperamide acts by combining with intestinal opiate receptors. So there are receptors called as opiate receptors in the intestine. So loperamide will combine with those and it will prevent diarrhea from taking place. Then many times they also give this microorganism called as Lactobacillus acidophilus. What it does is it will change the gastric pH in such a way that intestinal pathogens cannot grow in that pH. So if your diarrhea is being caused because of growth of bacteria, then that growth will be prevented because of this lactobacillus. So the next category of drugs are the purgatives. So we saw about diarrhea and how somebody needs antidiarrheal to stop the diarrhea. Now some people have the opposite kind of problem, that they are not able to pass motion in the normal way because the bowel movement is sluggish, it is not proper. So then in such case, if all the contents, if all the waste products are retained inside the body, it will lead to several other problems. There will be a lot of discomfort. Then the toxins will flush back into the body. They will not get thrown out of the body. So we need to make sure that whatever waste products have collected in the large intestine, they are then thrown out of the body. So if somebody is suffering from constipation, then we need to use certain drugs which will promote defecation. So these drugs are called as purgatives. So there are many different words which are used. So they all have similar action. So if you hear the word laxative or the word purgative or the word cathartic, all these mean the same action, that they will help to promote defecation. But the degree of the action will be different. So if the action is very mild, then it will be called as a laxative. If it is, medium, it is called as a purgative. And if the action is very strong, they are called as cathartics or drastics. Okay. So we have four categories of purgatives. First category are the stimulant or irritant purgatives. So as the name indicates, these will stimulate the GI movement or they will lead to irritation of the gastrointestinal tract, because of which there will be peristalsis and then the waste will be thrown out of the body. So anthraquinone compounds can be used. Drugs like senna, cascara can be used. Then some resinous compounds like jalap or colocynth can be used. Then certain irritant oils like castor oil can be used. And phenolphthalein, calomel and bisacodyl are also used as stimulant or irritant purgatives. Then we have the second category of drugs which are called as osmotic purgatives. These drugs, what they will do is they will change the osmotic pressure, and because of that osmotic effect, they will draw liquid into the GIT. Then examples are magnesium sulfate, magnesium citrate, milk of magnesia, and lactulose. The third category of drugs are the bulk purgatives, compounds like methyl cellulose, isabgol, agar-agar, and bran. Then we have lubricant purgatives, liquid paraffin and dioctyl sodium sulfosuccinate are the examples. So, little bit about all these drugs. Senna and cascara are anthraquinone glycosides. They are to be taken orally, and after you take that drug, after about 6 hours, the purgative effect will start. They produce semi-solid stools, and they can cause dehydration, because if you lose a lot of fluid through the stools, then there can be dehydration and they can cause little sensation of weakness also. Castor oil is very commonly, it was used in the olden times. It is obtained, the oil is obtained from the castor seeds, and inside the intestine it will liberate a compound called ricinoleic acid, and that ricinoleic acid has purgative action. Now it causes totally liquid stools. So if there is a lot of liquid which is going to get passed out, there can be fluid loss and dehydration. Also, because this is an oily substance, it may interfere with the body's ability to absorb other nutrients. Resinous purgatives, they act by irritation of the small intestine. These also can cause dehydration. Phenolphthalein can cause colic, palpitations and dehydration. So it is not actually much used. Bisacodyl is the commonly used drug nowadays. It can be given by oral route or you can give it as a suppository. You must have seen these Dulcolax suppository which is available, or Dulcolax tablets are available. That contains bisacodyl and it is quite non-toxic compared to all the other ones we have discussed so far. So this is the commonly used drug. Then we have osmotic purgatives. As I said, they have an osmotic effect. They are also called as saline purgatives because they are certain salts. Now what they do is, because of the osmotic effect, they will pull water into the intestine. And because of that, when the water quantity in the intestine increases, the bulk of the intestine increases. And that bulkiness will stimulate peristalsis. So the GIT will move faster. And because of that, whatever is there in the large intestine will be evacuated and thrown out of the body. They cause purgative action is very quick, but they may get absorbed into the body because they are soluble salts, and because of that there can be certain kind of systemic toxicity which is produced. The next category are the bulk purgatives. Now these are certain substances which are insoluble, so they don't get absorbed into the body, they will not be digested also, but they will sit in the GIT, in the stomach and intestine, and they will absorb water. So when they absorb water, they will swell in size, and because of that the bulk of the GIT increases, and that will stimulate peristalsis, which leads to a mild purgative effect. Then we have the next category, which are the lubricant purgatives. So this includes compounds like liquid paraffin and dioctyl sodium sulfosuccinate. So what the liquid paraffin will do is, it's a mineral oil like substance. So it will absorb water, and because it has absorbed water, it will prevent the feces from drying out. So many times people who have constipation, the constipation is because the feces have become very hard. So in such cases, the liquid paraffin will absorb the water, and because of that, the feces will become soft. So when it is soft, the friction with the anal wall is less, and because of that, the drug can be easily evacuated. However, because this liquid paraffin again is an oily substance, it can interfere with absorption of fat soluble vitamins in our body. Dioctyl sodium sulfosuccinate, it is a surfactant molecule, and because of that, it will lower the surface tension, and due to this surfactant action, the feces will become softer in consistency, so they can be thrown out of the body. So all these are the drugs under the purgative category. Then the next set of compounds are what we call as anorectal preparations. So these are drugs which are administered by the rectal route through the anus. And here we have two types of compounds. We can have enemas, which are liquid in nature, and we can have suppositories, which are solid in nature. So enemas are liquids and suppositories are solid. Based on the requirement, we will choose which of these two categories of products we want to administer. Generally, whenever you want to have localized action in the rectum, we can use these anorectal preparations. Or if you want to bypass the oral route, if you want to bypass the hepatic first pass metabolism, if you want to prevent degradation of drugs in the stomach and small intestine, or if you want to avoid toxicity in the stomach and small intestine, in all these cases, we can make use of the rectal route of administration. Sometimes children, they are small babies, they are not able to swallow a tablet or a syrup. So you can use suppository. There are, like, for example, you even have paracetamol suppositories which are available, small sized suppositories, which can be introduced in the rectum of the baby to help to reduce fever. So when we can't use the other routes, then for localized action or sometimes for systemic action, we make use of the anorectal preparations. So enemas, as we said, they are liquid in nature. There are two types of enemas which are used. One is called as evacuant enema and the other is called as retention enema. So if you want that whatever drug you are giving through the enema, if you want it to evacuate the contents of the intestine, if you want it to remove the waste products which are there, then it is called as an evacuant enema. So if we want to remove worms, or we want to remove excess of mucus or fecal matter which has collected in the rectum and it's not coming out easily, or if there is a lot of gas and we want to get that gas out of the body, then in such cases we use what is called as evacuant enema. And for this purpose, they make use of soap water or glycerine enema. Then the other category are what we call as retention enema. So in this case, this means you will deliver some drugs through the enema form into the rectum, and it is supposed to remain in the rectum for some time and exert its action. So if in the past they were using this often, now it is not so much used. Sedative enema. So if you want to have sedative action on the GIT, then opium combined with starch can be given. Then astringent enema, tannic acid can be given. And nutrient enema, saline or glucose can also be administered through this route. Then we come to the suppositories. So these are the solid drugs, solid dosage forms which we administer through the rectal route, and they are meant to have a local action in the rectum. So if somebody is suffering from constipation, they can be administered glycerine suppositories. Then suppose somebody is having severe spasm of the GI tract, then if they have that spasmodic problem, then you can't give them anything orally, because whatever you give because of spasm of the GIT, it will get thrown out through vomiting. Then in such cases, we can give it in the form of a suppository. So aminophylline suppositories are commonly used. These aminophylline suppositories will have antispasmodic action on the respiratory tract. I think you remember we studied about drugs, uh, we studied about asthma, where a person has bronchoconstriction and the bronchioles go into severe spasm. So if you want to exert antispasmodic action on the in a patient who has asthma also, we can use the suppository route sometimes. And then benzocaine suppositories can be given for people who suffer from pain or itching in the rectal area, in the anal area. Then we can give benzocaine suppositories for that purpose. So this is about suppositories. So we have covered now the remaining whatever was left of the GIT drugs: emetics, drugs which cause vomiting; antiemetics, drugs which act against, they prevent or control vomiting; then antidiarrheals, drugs which are used to treat diarrhea; purgatives, drugs which are used to treat constipation; and we have talked about anorectal and suppository preparations.